Live from Washington, this is a special Your Voice, Your Future National Town Hall, Ebola in America.
Ebola, additional cases of Ebola,
symptoms of Ebola.
Whether it's in a practical sense or one of panic.
I don't feel safe.
The disease that so firmly grips its victims has also taken hold of our daily lives.
We have to work now so that this is not the world's next AIDS.
The first real sense of alarm, a Liberian man, Thomas Eric Duncan, brings Ebola to Texas. The outcome proves fatal. Meanwhile, 2 nurses who treated him become infected.
85% of the nurses say they are not adequately trained.
Their friends and family under careful watch. And while airports get new rules, there's a rush to find a vaccine. And at the same time, educate.
The way you get Ebola is by direct contact with the body fluids of an ill individual.
Medical specialists agree it must first be stopped at the source, in Africa.
We're glad you're here, man. Hoorah.
Hundreds of U.S. troops are now on the ground, building hospitals and assisting in quarantines. Spain, Germany, France, more cases popping up. Is it all, though, lacking perspective? This a real-time, dizzying display of Ebola mentions on Twitter.
The prospect of an outbreak here is extremely low.
And on the same day, nurse Nina Pham is declared cured.
I believe in the power of prayer.
A new case pops up in the city many worried could be the worst place for it, New York. A doctor recently working in Guinea.
A team went out with protective gear. He was picked up.
And precautions reaching a new high. A nurse back from Africa quarantined in New Jersey despite testing negative.
Joining us for tonight's town hall, Dr. Scott Betzlos, Chief Medical Officer for Inova Fairfax Hospital, Dr. Ben Carson, former Director of Pediatric Neurosurgery at Johns Hopkins Hospital, Congressman Jerry Connolly of Virginia, Nelson Sabatini, former Maryland Secretary of Health and Mental Hygiene, and registered nurse Rajani Ward.
Good evening and thank you for joining us. I'm Scott Thuman. Over the next hour, we are talking about something that is clearly on the minds of many and has become a top priority around the country and the world, the Ebola virus. And there is some big news on this day regarding quarantines, with some politicians, even the Pentagon, countering what the White House has advised. The Army will now isolate all troops who return from serving in Ebola-stricken nations and monitor them for 3 weeks. To that point, a 2-star Army general and 11 members of his staff have just been quarantined in Italy after a mission in Africa and are being monitored for symptoms. And the nurse you saw in that video, quarantined to a tent in New Jersey, has now been allowed to go home. On top of all of that, just in the past hour, the CDC announced new recommendations that people at highest risk avoid commercial travel or large gatherings, even if they have no symptoms. We know there are a lot of questions about this disease and how we can stop it, both in devastated areas of Africa and here at home. I am joined by this esteemed panel, Dr. Scott Betzlos, Representative Jerry Connolly, and Nelson Sabatini. Welcome, gentlemen. We appreciate you being here.
Great to be with you, Scott.
This hour, we're also going to speak to registered nurse Rajani Ward from National Nurses United and renowned Dr. Ben Carson, who is joining us from Seattle. We want your input as well. We encourage you to join our conversation using the hashtag #YourVoiceYourFuture. We also have physicians standing by to take your calls. It is all happening in our social media center. That is where Kai Jackson will be monitoring activity throughout the hour. Kai?
Scott, we have a lot going on here. This is the Social Media Center, and what we're looking for tonight, we want to hear from you. As Scott mentioned, you can hashtag #YourVoiceYourFuture to Twitter and give us your thoughts and your questions about how to deal with Ebola. So we're going to show you your comments, what people are saying, and perhaps one of the best ways to get rid of misinformation is through facts and through science. Also in our Social Media Center tonight, we're very, very happy to have 2 infectious disease experts from a local hospital. They're on the front lines trying to find ways to battle Ebola. Tonight, they're going to be manning our phones and answering questions from you, our viewers, that you have about Ebola. So I'm going to maintain the Social Media Center here. Our phones are ringing right now. We ask you to call in and let us know what your questions are. We're going to go back to Scott, and when we do have questions, when we do have comments, we're going to pose those to our guests in the studio. Scott, back to you.
All right, sounds great. Thank you, Kai. I want to begin with what just happened in the past hour, and this is the recommendation that we saw from the CDC about large groups avoiding certain commercial travel. Dr. Betzlos, why are we just now getting this? Are we late to the game on these recommendations?
No, I don't think we are. I think that as you see the responsiveness evolve over time, as we become to better understand Ebola and to better understand the psychological component within the country, I think you're seeing appropriate reactions and proactive actions that are taking place, and this is just one of them.
But why now? Well, why didn't this come out weeks ago?
In terms of the commercial travel for high-risk patients, probably could have.
Yeah. Here's the thing. You had at one of your hospitals, we had a potential scare. You had a patient who came in. There were some questions about symptoms. Are we prepared? Were you all prepared?
We were prepared for this patient that came in. You're speaking about the patient from the Pentagon.
Yes,
yes, we were prepared. We actually developed a special care unit where we can take care of these patients, but also designed our emergency department to handle a patient with suspected Ebola. Our nurses were trained with PPE to care for these patients, and everything clicked off very well when that patient arrived to our emergency department.
Let's go down to our newsroom. We've got a remote camera with Nurse Rajani Ward, because you represent National Nurses United, an organization that claims that there needs to be a lot more going into the preparation for nurses. What's your take on this? Are you being prepared at this point? Are you adequately protected?
So thank you for that question. And, I would say the first thing I want to say is that, nurses are like first-hand caregivers. We're the people at the front lines. And nurses, across the country are not adequately prepared, and the issue with that is that we really need to have the proper protective equipment in place and interactive training. And what would help with that is having a national mandate from either Congress or the President to help with that, so that all nurses across the country have optimal standards and protective equipment.
Interesting you say that. At Fairfax Hospital, what we designed was a 4-stage process for training, and that training involves the PPE training, and then if you can't tolerate N95 masks, then we'll put PAPR training on. And then we also go as far as to use in our simulation unit, we have a 4-camera simulator that can actually see all angles. So what we're doing is actually going to video the doffing. That's when you take off the PPE, the high-risk part,
right,
and look for any breaches. And then we're also going to use our simulation center to put nurses and techs and doctors in the PPE, and then let them try and practice medicine on a simulation mat. So putting in IVs, et cetera, because once you're in these suits, your pulse rate goes up, your respirations go up, you get nervous, your hands shake, and it's a completely different atmosphere of practicing environment that you're practicing in.
All right, well, Congressman Connolly, she brought up the idea of Congress and the President and standards being set. You oversaw a lot of this committee hearing we saw on Friday, which some valuable information came out of. One of the things you said is, quote, panic makes poor policy. Are we panicking?
I think there have been aspects of that in media coverage of Ebola. That isn't to lessen the threat. It's a lethal disease, and left unchecked, obviously, is an enormous threat to civil society, as it is in West Africa, increasingly. It is not that kind of threat here. It's contained. Of the 7 victims up to now, or 8, 1 died. The other 7 fully recovered. We don't have that kind of rate in West Africa. So I agree with Dr. Pizzella said, here in the nation's capital, we are well equipped. We are prepared, I think, to deal with this threat as we know it now. Clearly, however, the hospital in Dallas was not.
Right.
And
mistakes were made early on.
Exactly. And I think there were some initial missteps by CDC, including false assurances to the public, that are always dangerous in this kind of situation because they damage your credibility as you move on.
As you move, right. So as these recommendations come out, people start to question whether or not the CDC knows what it's doing, because early on mistakes. They never should have, well, I don't want to assume, but we understand that when Amber Vinson, one of the nurses, was allowed to travel, that there were checks with CDC. She was supposedly given the nod that it was okay. In retrospect, CDC probably would not allow that to happen. And I'm sure when you saw your hearing on Friday, you might be of that same vein of thought.
I think that's right.
Okay. Before we go, I want to get a viewer comment in here. But first, I want to come to you. Nelson, what we're seeing right now, which is these quarantines in states where they say, we are going to, if need be, take someone who is showing maybe not even symptoms, but maybe they have a bit of a temperature, but they were in one of those 3 countries. We're putting them in a tent for 21 days if need be because it's for the greater good. You helped run the state of Maryland when it came to health. Would you do that same thing?
I would hope no.
And why?
Because I think that to the extent we're going to make some decisions like that and these kind of policy decisions, we ought to make them on the basis of what the scientific experts are telling us. I mean, I have great faith in people like Tony Fauci, who was one of the people that led us through the whole HIV hysteria early on, and is there today. And they are saying that it's not necessary. At least they were saying it's not necessary.
Sure.
I mean, the dilemma, and the thing that troubles me most about what's going on, is that there is no single voice from the public policy.
There needs to be some unity on that.
I mean, we need a Surgeon General desperately.
Right.
We need a Surgeon General.
We have an Ebola czar, but not a Surgeon General. Let's and you mentioned the line that the White House has been using, which is things that are grounded in science. We'll get to that again just a little bit later. In the meantime, though, the quarantine's been the subject of a lot of controversy, and we have been asking people all over the country to give us their questions, many wondering, am I next? Listen in.
I'm Rob Lifflander from Greenwich, Connecticut. And my question is, at what point is the city going to require people who might possibly be infected to stay under a 21-day quarantine?
Gentlemen, anyone want to chime in on that? I mean, the subject is whether or not these 21-day quarantines for someone who seem to be at risk are a good idea. Do we agree that it's a good idea at some point to quarantine?
You know, it's an interesting question, and I think it has 2 components we need to discuss. First, the psychological component of the community that you're in, and secondly, the scientific basis of the quarantine. And I think those are 2 separate discussions that converge onto this.
Okay. Dr. Ben Carson joining us now live from Seattle. And Dr. Carson, I'm curious, you've been outspoken on the issue as well. Are we handling this correctly? Do these quarantines need to be more thoroughly examined as an option, or was it a bit of panic that we saw in New York and New Jersey over the weekend?
Well, I haven't really seen what I would describe as panic. Certainly people are very concerned, and for good reason. This is an extremely dangerous disease. And even decades ago, when people would come into this country, they were screened quite carefully. At Ellis Island, if there was a question of them carrying some infectious disease, they were quarantined. These things have precedents that go back quite some time. I think we're learning as we go. And I think perhaps the reason that some people are a little unsettled is because, we're not getting consistent responses and we're getting changes. And particularly when somebody tells you there's nothing to worry about, everything's fine, and then somebody comes in with the disease and 2 of the nurses, catch it and they're supposed to be well protected. Obviously that doesn't foster a lot of confidence. So at some point I think it's worthwhile to think logically. What I always do in these dilemmas is ask 4 questions. What's the best thing that happens if we do this? What's the worst thing that happens if we do this? What's the best thing that happens if we don't do this? What's the worst thing that happens if we don't do this?
Sure, best case, worst case scenarios, yeah.
You ask that in the case of quarantine, and I think you can come up with a pretty good answer.
Okay. Dr. Carson, thanks. We'll check back in just a bit. In the meantime, I want to go to our social media center downstairs. Kai Jackson, speaking of questions, you're getting some of them now, right, Kai?
We are, in fact, Scott. Our infectious disease experts are on the phone as soon as the show started. The phone bank pretty much started lighting up. So our infectious disease experts are getting questions in from the public. And we want to encourage you to call. You can call into our phone bank at 703-647-1533. Let me repeat that number, 703-647-1533. Now, Scott, we're also getting some hits on Twitter as well. Here's one of the questions we have tonight. How are hospitals preparing for Ebola? How can we ensure that all hospitals are prepared to handle an Ebola patient? I think that's a very general question that, Scott, you and I as reporters often hear out in the public? Let me throw it back to you and see how our panel of experts would like to answer that question. Scott?
Doctor, I think the best part of that question was implying should there be a standard. What happened in Texas, and we all admit there was a mistake there, but what happened in Texas, the nurses have gone on record in saying they kind of went at it on their own. They first went in with relatively unprotected gear, perhaps considering the gravity of Ebola. And then they took steps on their own to double glove, to use full body suits. They went above and beyond what the CDC recommendation or standard was at that time. Doesn't there need to be a standard across the board for all these hospitals so that we know what we're dealing with?
Sure, it sure does, Scott. And I think that a very structured approach to PPE, somewhat what I previously described, is what needs to happen at very large health organizations across the country to prepare their health systems for this, for a potential patient should they come to their hospital.
Please.
I think the short answer is yes, and the nurses are right. There has to be a robust set of standards for how to deal with Ebola. That does not mean every hospital in the United States is going to be able to comply with that, and therefore they're the wrong place to go, some of those hospitals, if in fact you're showing symptoms that are suspected because of where you came from of Ebola. So we need to recognize that. But I mean, this is not a new challenge for the United States. We have standards for epidemics. We have standards for chemical or biological attacks. We've done a lot of emergency preparedness since 9/11, and many of our hospitals have robust stand-ups to deal with that. But not all of them have the capacity for isolation and protective gear. And as Dr. Betzlos said, there are challenges in working in that environment for medical personnel.
Okay, so Rajani Ward, I want to check in with you again because the study that your organization, National Nurses United, claims to have done surveyed some 3,000 healthcare workers and nurses at 1,000 hospitals, every state in the district represented in that survey, and you claim that 85% of nurses feel that they aren't adequately protected. That goes into the idea of having a standard and having preparation. Where do you think this is going to go? Don't you at some point believe there will be a standard? All the equipment would be provided to your nurses, or as the congressman just pointed out, not every hospital can be situated for something like this scare.
I mean, my answer to that would be that, as I already mentioned, a congressional or an executive mandate for those standards. I do recognize the standards and precautions, and a lot of hospitals have gotten better, but it's been like a very evolving response to this Ebola crisis. But I would say that 85% of nurses is a lot of nurses in the country that believe they're not prepared. And
all right, Rajani, that's a great point. Doctor, they feel unprepared, even if you say in many cases
they probably do, because 85% of the nurses are not going to manage the Ebola patients. Right. It's a very subset group of nurses within a hospital system, that will actually manage the patients. We're talking about we have thousands in our organization, and we're talking about a subset of probably no more than 50 that will actually care for an Ebola patient.
Okay, and that's an important piece of perspective there. Yeah. You were ready to say something else.
I think there's also something I agree with the congressman. Not every hospital in this country should expend the resources necessary to care for an Ebola patient. But by the same token, you never know when an Ebola patient is going to walk into the door of that ER in some small rural hospital. And there are levels of standards. There has to be a standard that protects the people at the initial impact
there shouldn't be question marks when someone walks in.
No, what I really find frightening is we're embarking now on the beginning of the flu season.
Well, and
symptoms are many people are going to be presenting themselves.
And let's go back to that.
We need to get you all need to get flu shots.
And that was the recommendation. I interviewed Dr. Richard Besser the other day, who said, I hope that this makes people go out and get their flu shots. Exactly. And we're going to talk about the flu and numbers regarding that for some perspective in just a bit. But we have been talking about the folks who are concerned all across the country, especially young people as well, who are attuned to this and trying to educate themselves. And here's what one college student in Oklahoma wants to know.
My name is Jonathan Parker from Tulsa, Oklahoma, and my question is, what is the plan of action for containment if it was to hit a university?
So if we're talking about a large population, obviously a transient one when you talk about students, have we thought about that? Has that been something that's been addressed, or is there a war room over at the CDC and NIH where they say if suddenly we see an outbreak, not just a case or two, but an outbreak among a population like that at campus, do we know what we're going to do? Or is that just unreal?
You know, that's a completely different scenario than what I'm sure we're planning for right now, and that's a game changer.
I think we need to be careful of the language we use. I mean, the student's concern is perfectly legitimate, but what does it mean to say an outbreak on a campus? This is not a disease easily transmitted, especially in an advanced society such as ours, with very high hygiene standards and the like. So the idea that there'd be an outbreak like there would be the flu or some other infectious disease is very remote. And that doesn't mean we don't take precautions in the eventuality someone gets sick and is diagnosed with it, so we protect the broader population. And that's why we're talking about quarantines and protocols to protect the broader public. And that's why there hasn't been an outbreak in the United States, unlike, sadly, West Africa.
Yeah.
And we do need to focus on that at some point in this town hall.
Absolutely.
Because if we don't address
that,
the
source.
The problem grows here.
And that's one of the universal claims among everyone, regardless of their position on this argument, is that it has to be handled in Africa because you have to stop it at the source rather than allow it to develop even further. Dr. Carson, I know you wanted to chime in here.
Yeah, well, we have excellent facilities, excellent care here, and that's why the people who have been infected who've come here have gotten well for the most part, except for Mr. Duncan. But I do think it is very important, with respect to the question that the student asked, that we have contingencies and plan. And we must not always plan for the best case scenario. We must plan for the worst case scenario. And there are a lot of significant things that could happen. We need to be ready to act immediately if and when those things do happen.
All right, Kai Jackson back in the social media center. You've got more coming in over Twitter. Is that right, Kai?
I do, and that's right, Scott. Things are really lighting up. I'm going to pose a few questions here and then toss it right back to you, but some great questions are coming in over the phone bank and a couple through Twitter as well. The question through Twitter, and I want you all to take note of these questions so that you can respond to them. First, and we haven't really talked about this in great numbers, I think, through the discussion of Ebola. Can Ebola be transferred or transmitted through sexual intercourse? I think that's one question that people have. Another question is, why not close all the borders? Now that gets into a governmental issue, and we're talking about immigration and things of that nature. That's probably not as simple as people think, but that's a question. Why not close all of the borders? The other one was more of a statement from a nurse's aide from Sierra Leone. Now, she called into the phone bank and said, everything is really being focused on the United States right now and the threat and concern of Ebola. She said, but obviously with it being such a priority in West Africa, why not focus more attention and resources on West Africa? I don't think she was alluding to the fact that it's not being done, but she feels like there's a disproportionate focus on the United States as opposed to Africa, really where it's centered.
Yeah, all right, great points, Kai.
Scott?
And okay, so let's talk about that, gentlemen. Obviously, when you talk about West Africa, and that's something that we're just echoing a sentiment on, that has to be where we send the resources. But isn't it, along with this argument, isn't it by doing something, as some might argue, rash, as closing borders or banning flights, is it true that you're discouraging the healthcare workers that we need to go back and forth to tend to the African issue? Is it really going to discourage them, and therefore we're just hurting our own cause here?
Oh, I think, mandatory
travel ban.
Would do that. I just, I'm saying that, you're not going to come, if you come back from one of these countries, you're going to spend 21 days regardless if you're symptomatic. Would certainly discourage it. I also think it would be, I mean, we do have a constitution. I mean,
well, that's right up your alley here, Congressman.
There
is the Constitution playing into this?
I don't think can necessarily be abridged by Ebola.
Yeah, what a troublesome thought there, Dalton. Well, but let's look at, the issue is efficacy. Does it work? And I think we know that it would be counterproductive. It might make us feel good. It might make some politician look like he's doing something. But as a matter of fact, right now, we can monitor everybody coming into our country who is originating from the 4 affected countries. If you have a travel ban, they go underground and you have no earthly way of knowing who's coming into your borders. You can try, but you've lost a control that right now is in place. Secondly, as Nelson points out, you will discourage, if you do that, the very people we need at the front in West Africa to contain and roll back and ultimately prevail over this disease if you don't. I was showing Scott, I think he didn't believe it, it was so extraordinary, but if we do nothing, the CDC has projected you could have as many as 1.4 million Ebola victims in the 4 affected countries and spreading. That will inevitably affect us if we let it get to that. So we've got to have a two-pronged strategy. Protect and prevent here at home, and that's what we've been talking about up to now. But secondly, we got to go at the source with every resource we got internationally and from the United States to roll back this epidemic.
So is Congress doing enough? Look, a lot of people want this to fall on the shoulders of Congress. Well, there are probably many who don't. But Congress obviously plays a role in any big issue like this, and some are saying, where's Congress, where's the president? Now look, we've got an Ebola czar, we've got almost daily meetings. You had a hearing on Friday that was enlightening, but what is Congress not doing that it needs to?
Well, one of the things I hope Congress stops doing is playing politics with this issue.
But I read your comments when you said that. Do you really think that this is taking away from the subject, that there's a lot of politicking going on about Ebola?
I think there's some politicking going on with Ebola, and certainly the inference could be drawn that somehow it's the president's fault. And I just think that's irresponsible and doesn't help the situation one bit. One of my colleagues, Trey Gowdy, went after the administration for naming a non-doctor, and he went through how ridiculous it was.
You're talking about Ron Klain.
Yeah, Ron Klain would be the Ebola czar. Well, the job calls for managerial expertise, not medical expertise. We get the medical expertise, but this is a different kind of job. Nelson pointed out where we want the medical expertise, and Trey Gowdy and some of his friends have, in fact, been silent about this, and that is we need a surgeon general. Who is a doctor?
What about funding? Do we need more funding?
Of course we need more funding.
Where does it go? Where's the money go?
Well, it goes to WHO, it goes to CDC, it goes to NIH, it goes to Emergency Health Preparedness at DHHS, the Department of Health and Human Services. That budget has been cut in the last 8 years from $1 billion a year to $612 million. What could go wrong with that?
And are there tangibles? Do we physically see something that we're going to buy with that money?
Well, start with what the nurses point out. Protective suits have a lifespan. They're not forever. Yep. And by the way, once you put it on and you've been in an exposed area, you've got to destroy it. And you've got to destroy it carefully. Yep. So that has to be replaced.
Well, and a lot of the shelf life that we see on equipment that is currently in this, basically our warehouse is full of protective gear. The shelf life on a lot of these runs out in 2015, doesn't it?
Absolutely. And again, but we've been through this before with anthrax and in getting ready, God forbid, for a radiological event. After 9/11, we tested for that. We bought protective suits, and we've learned a lot about the replacement cost and the maintenance cost of all of those efforts.
Okay, then let's listen to that testimony from Friday about the supplies that are on hand and the need to improve.
The material DHS has purchased has a finite shelf life. For example, TSA's stock of pandemic protective equipment includes about 200,000 respirators that are beyond the 5-year usability date guaranteed by the manufacturer. In fact, the department believes that their entire stockpile of personal protective equipment will not be usable after 2015.
All right, is that scary, doctor? Is that scary to hear that this equipment that your nurses and doctors in theory would be using in another scare or an emergency, that there's a limited supply of that?
It's part of the investment process in terms of building a unit that can handle these kind of patients, and then building and having the operational training costs and investments that go along with that, and then the actual cost of the personal protective equipment.